Hi, nice to meet you all. My name is Dr. Ragavan. I am a Uro-Oncologist. I am a specialist in urological cancers. Today we are going to talk a lot about the urological cancers. So to start with, we need to understand what are urological cancers and what is Uro-Oncology means. Urological cancers include cancers from the urinary tract. This is from the kidney, from urinary bladder, the tube that connects the kidney to the bladder, prostate gland, penile and testicular cancers. So I am a specialist who deals only with these cancers. The next cancer we are going to deal is called bladder cancer. Bladder cancer arises from the urinary bladder. It is a cancer called transitional cell cancer. How will anybody come to know that they have bladder cancer? The most telling symptom for bladder cancer is hematuria, that is blood in the urine. In another video, we are going to talk about hematuria itself, what to do and what not to do. Having said that, once somebody has hematuria and eventually finds to have a tumor in the bladder, the first thing to do with that situation is to consider removing the tumor with the help of what we call endoscopy or cystoscopy. In that process, you remove the cancer or the tumor, send it for testing to prove that it is a bladder cancer, and if it is proven to be bladder cancer, then in the majority that treatment itself is complete. You don't need any extra treatment. Sometimes we do put a chemical in the bladder called Mitomycin, a chemotherapy, in order to reduce the chance of the bladder cancer coming back. Okay, now once we have diagnosed the bladder cancer and we have put the chemotherapy, what should we do further on? We should keep yourself in monitoring system. That is, every 3 months or 6 months, you need a quick checkup with a small bendy camera called flexible cystoscope, and all you do is just go into the doctor. They will put a tiny camera in, check the bladder, make sure the cancer has not come back, and send you off. So the majority of the patients have low-grade cancer, low-stage cancer. Just the first treatment and maintenance scopies are enough for them. Okay, now let us go into the less common things. In some patients, that cancer can be aggressive and just checkup is not enough for them. They will need something called BCG, which is actually a tubercular vaccine being put inside the bladder, and that stimulates the bladder and the body's own immune reaction in order to stop the cancer coming back. It is a very effective treatment. However, it has lots of side effects. Patients will have a reasonably difficult time going through that process, where they will have a lot of symptoms before they settle down with BCG therapy. Okay, in a situation which is even more advanced than this, that is a cancer which is going deep or which is starting to go outside the bladder, we may have to do something more, which may include something called radical cystectomy, where we remove the whole bladder and do a construction in a way that the urine either comes into a bag on the side of the tummy, or urine can come through the normal passage after coming into a pouch. So this is called ileal conduit or neobladder, which is done after radical cystectomy. In some patients in selected conditions where we can remove the tumor to the best of the knowledge, we can give radiation from outside in order to reduce the chance of the cancer coming back again. Bladder cancer, unlike prostate cancer, how much ever we treat, a proportion of patients, it can come back again. So before or after doing these treatments, one may consider to give chemotherapy called Neoadjuvant or Adjuvant chemotherapy using certain drugs in order to make sure or help in the best of our ability for the cancer not to come back again. Now, what is the take-home message here? If you have blood in the urine, you need to consult your local doctor and make sure that you are tested for your bladder cancer and the appropriate treatments are made after that. How and why does the bladder cancer come? We know for sure smoking is an important component for the bladder cancer to come in future. So if you are a smoker, this message should reach you very clearly that stopping smoking is one step forward in order to reduce the chance that you have bladder cancer in future. Thank you.